Hello, everybody. Welcome to Understanding the New CCDF Health and Safety Standards and Training Requirements webinar, which is the first of a series of webinars that the Office of Child Care is very pleased to offer you as part of rolling out and supporting our grantees with the implementation of the Child Care and Development Fund Final Rule and the Child Care and Development Block Grant Act. My name is Rachel Schumacher, and I am the Director of the Office of Child Care, and I am here just briefly to kick off this webinar, and then I'm going to turn it over to some very able folks. Min Lei, who's the Program Specialist for the Office of Child Care, and Katie Beckman, who's a Senior Policy Advisor for the Early Childhood Health, Early Childhood Health and the Office of Early Childhood Development. And then we're going to have some wonderful speakers from Indiana and Oregon who will be introduced later, who we're very glad to have here, because what we think is really critical for everyone on this call is to have a chance to talk to each other across state lines and across the country about what we're learning about implementing the new requirements and to share those lessons learned. And as you all know, and you've heard me say many times, the Office of Child Care is really committed to supporting all our grantees to being successful in their implementation. One of the most agreed upon aspects of this bipartisan reauthorization was the need to better protect children in child care and give parents peace of mind when they drop their children off at child care every day. And the health and safety provisions that we're going to talk about today are really sort of a no-brainer when you talk about them out in the world or on the Hill. They're very clearly outlined in the law. The rule added some definitions and responded to questions that we received from states and others during the whole rulemaking process, while retaining some flexibility for states in the details of how to implement, which is why we need to have these sessions to be able to share stories across state lines. As you know, health and safety trainings were sort of the one area of waivers that ACF did not approve when we had our opportunities for states to ask for extensions. And the reason that is because they were so critically a part of what Congress was seeking to achieve in passing this legislation. And we ran that idea up the flagpole before we did it, because that was what we thought Congress wanted, but we really wanted to make sure folks had a chance to think about it. But given the headlines that we were seeing around cases and programs and homes around the country with providers who, if they had just had a little bit more information about how to prevent SIDS or how to perform infant CPR, tragedies could have been avoided, and all sides that we talked to agreed that this was something that was really important to implement as soon as possible. But we really recognize at the Office of Child Care that you have a lot of challenges sometimes in your states, and that the devil's in the details when you're implementing. You have a lot of choices to make, and it's always helpful to hear what folks are doing in other states when you're making your decisions. That's why we made this the first of our series to help share those lessons learned. So we're going to have some states that have forged ahead and some states that have started at different places in the process, because that's how we all learn from each other and do excellent work together. And we know you're at different stages. We know everyone on this call is at different stages, perhaps in your own implementation, and have state-specific issues that you're thinking about, or tribal and territorial issues. But we know everyone on the call wants young children to be healthy and safe, and we want our teachers, our caregivers, our family child care providers and directors to know what to do and to make sure that their practices change and how they interact with the children and families. They really know how to handle emergencies and keep children healthy and safe every day. So thanks to the hard work of our rule rollout team, we hope this session helps you, and we really want feedback on what worked and how to improve the series for the future ones. So do share that with us at the end. Without further ado now, I am going to turn it over to Min Lei.
Okay, thank you, Rachel. Good afternoon, everyone. Thank you for joining us on the first of, well, Rachel said, as Rachel said, a series of webinars. I know that a lot of you have seen overview webinars that we've done on the rule, there's a lot of information there, so we wanted to be able to have standalone sessions where we really did dive into a particular topic. And we determined the topics based on a lot of the questions that we were getting, a lot of feedback, where there were areas that people said they wanted additional clarification. So as Rachel said, what I'm really interested in is getting to hearing from what states are doing. So we put together this slideshow. These will be posted once they're made compliant. So there's a lot of information here. I'm not going to dwell too much on the statutory and the regulatory provisions that a lot of people have already heard. But we'll go over those, and then at the end there are some questions that we've received that we're prepared to answer. So we'll get to those. Okay. A lot of you may be familiar with this slide. There are 4 major areas of the law addressed in the regulation. Today we're focusing on protecting the health and safety of children in childcare, and particularly the training aspect of that. Again, just going over the effective and compliance date. The rule goes into effect 60 days after publication, but full compliance with aspects that are new in the rule are not expected until September 30th, 2018, and compliance will be determined through the plans and federal monitoring. So the first slide here, I think will be useful for people once we have this up online. Just like these are the main sections of the reg where, if you're interested in training the regulatory languages. So at 98.41, it outlines the health and safety requirements, which are the topic areas. And then at 98.4 they make reference to the fact that you have to have trainings on those topics. But then at 98.44, we go into more detail about what the requirements of the training and professional development are, including at A, the professional development framework, then B, a description of pre-service orientation, and then additionally ongoing training. So I wanted to just put the regulatory references there for those of you who like to dig into the actual rule itself. I'm not going to go through all these, but we want to list all the standards and training. So there's 12 listed here, and then there are also an additional number of optional training. So you've heard about the prevention and control of infectious diseases, Dept prevention of safe sleep practices, pediatric first aid and CPR. But again, I'm not going to go through all of those at this time. The question that we get a lot is, how do these health and safety provisions apply? So I broke it down as to who it applies to. It is for teachers, caregivers, and directors. And the where, it's for teachers, caregivers, and directors who are serving children, CCDF children, in all settings. That includes license exempt, and care provided in the child's home. The lead agency does have the option to exclude relative providers from these requirements, and that's consistent with previous regulations. And another point that we wanted to clarify is that federal requirements do not prevent lead agencies from applying training requirements more broadly or adding additional health and safety topics. So in addition to the requirements of the law, the final rule does a couple of things. We define pre-service or orientation as being within 3 months of starting. And we specify the health and safety requirements should be appropriate to the age of the child. And then we also refer to caring for our children's basics as a voluntary baseline for standards. The next couple of slides deal with the professional development framework, which is at 98.44. I'm not going to go through all this, but it's showing that when you're developing your training, there are certain things to keep in mind, such as developing it in consultation with state advisory councils, engaging training professional development providers, addressing professional standards, establishing qualifications to promote social, emotional, physical, and cognitive development of children, and improving provider knowledge, including a progression of professional development, reflecting current research and best practices, improving the quality and diversity, stability, and retention of caregivers, teachers, and directors. So I said I wasn't going to go through all those, but I actually did. Another thing that we kept in mind as we were developing this rule is that we wanted to make sure that it was intentionally aligned with the Hetzer performance standards, which came out a little bit before our rule did. And this was we really made an effort to make sure that they were aligned so that there wasn't a unnecessary duplication of effort. We know that there are training requirements. A lot of people were wary about having to do the same training twice to meet different standards. So we did that alignment, and we encourage the documentation of these trainings should allow for tracking to ensure that there isn't a need for repeating the training. So we mentioned that we reference Caring for Our Children Basics as a voluntary baseline. So just a quick overview about what that is. It's a set of recommendations intended to create a common framework to align basic health and safety efforts across all early childhood settings. So it provides guidance on voluntary basic minimum health and safety standards. It reduces a lot of the conflicts and redundancies found in federal program standards, enhances state child care licensing practices and QRIS, improves efficiencies in monitoring systems, and creates a consistent floor across Head Start, child care, and pre-K. So, like I said, I kind of breezed through those because that's a lot of information that people had seen before. And now we'll move on to some Q&A. So these were developed based on feedback that we've gotten from states, questions that have come in. So first question is, why are there 11 health and safety standards but 12 required trainings? So as I said before, there's the rule outlines these in two separate sections. So at 98.41A1, it details 11 health and safety topics, requires pre-service and orientation and ongoing trainings in those 11 areas. But in addition to those 11 areas, at 98.44B13, we added child development training. So that makes it a total of 12. So the next question is, does pediatric CPR and first aid have to result in certification to meet the requirements? This is a question that we get a lot from states. So while pediatric CPR and first aid are typically tied to certification, it's actually not a requirement of the rule. When establishing their requirements, the states should consider how to best demonstrate competency in these areas, which may include requiring certificates if they're available. Okay, next question is there a minimum number of training hours required? So no, there is not a minimum required number of training hours. However, the lead agency must determine what their minimum training hours is and report that in their annual training hours in their plan. In the final rule, while we don't require a minimum number, we do recommend 30 hours of pre-service training and between 24 to 30 hours of ongoing training annually, and we consider that to be a reasonable benchmark for states to consider. The next question, are staff required to be trained on all the health and safety topics on an annual basis? So as we mentioned before, there's a requirement for pre-service and orientation training, but also an ongoing training component. So a lot of states wanted to know that do they have to do all 12 of those areas on every year? So the answer is that there's flexibility in this area. States and territories are required to have ongoing training to ensure the providers have up-to-date understanding and maintain healthy and safe environments for children. However, states and territories do have flexibility to determine what health and safety training should be repeated and how often they need to occur as part of the ongoing professional development for their caregivers, teachers, and directors. This is a continuation on that same question. So health and safety topics that have certifications can serve as a guide for when health and safety topics should be renewed. So for example, if CPR certification lasts 2 years, states may want to consider that and take that into account when they're determining the frequency of their training. The next question is, can health and safety requirements be met through online training? So we do provide we do have some resources on available online trainings, and it is a very valuable resource for meeting these requirements. We do say that lead agencies should consider whether certain trainings should require in-person training in order to achieve minimum competency and improve on health and safety practices. And we believe that a mixed delivery training system that includes both online and in-person trainings can meet the varied needs of childcare caregivers, teachers, and directors. So those are the questions that we have answered so far. I hope that those listening find them helpful. We've also included resources here for people to look at, and again, we'll be making these slides available once we've made it compliant. And we also have a hopefully useful handout that we'll be putting out there as well with a lot of this same information. The resources we have here are just links to Caring for Our Children Basics, and then some of the technical assistance resources that we have, as well as we've done some research on compiling links to existing trainings that are available. So hopefully states that are looking to establish some of these requirements will find that they're not starting from ground zero. There's already a lot out there that people can draw on. So that is the drive policy part of things, and now we are going to turn it over. Give me 1 second to pull up the slide. The first state we have is Indiana, and I'll be introducing Rhonda Clark, who is the Deputy Director of the Office of Early Childhood and Out of School Learning. Is that correct, Rhonda?
Yes, it is. Thank you.
Thank you.
So you can go on to the next slide.
Okay.
So I wanted to start out with our communication plan out to our providers. We began in 2015 talking to them at conferences and trainings and just letting them know that this is a new requirement for them. We also started mailing letters to them, and beginning in June of 2016, we mailed, well, no, let me back up. Beginning in May, I believe, we started mailing monthly letters to them about the requirements and when the due date was done and how they could make sure that they were in compliance with this requirement. And the last, in the month of August, we mailed every other week, and in September, we mailed every single week these letters as reminders. We also sent out email reminders to our providers. And we used the CCRNRs to help spread the word, just trying to make sure that everyone was well aware and no one was caught off guard at the last minute. Go to the next slide, please. So we also developed modules, online modules for our providers. And I apologize, the first one is actually around health. It's just a health module. Then we have a safety module. Both of those modules are 4 hours each. And we have 2 modules also. One is around child development, birth to 5, and it's 2 hours. And the other one is child development for school-age providers. And it's for school-age providers. So we've had a really good response to these modules. They're very interactive. They're online, but also for those providers who weren't comfortable with the online setting, we took the modules and we developed face-to-face trainings as well. Like I said, we've had approximately 14,000 to 15,000 people take these trainings, so they've been, the feedback we've had has been very good. Next slide, please. The other thing we looked at was the topic-specific webinars. So we looked at the training topics, and they're all available in a webinar format. Each one of these topics, we have 1 to 2 hours of content on them. CPR and first aid, of course, need to be done by a certified instructor, and participants receive a certificate for that upon completion. But so we have topics, we have webinars on all of these topics that are at least 1 to 2 hours, so it goes in a little bit more in depth. Next slide, please. So another thing we did was we reviewed prior coursework and trainings. We looked at caring for our children, and we developed a required content list for each one of the topics. So we really wanted to make sure that we had some consistency around the state about what was being about what was being offered and what would be counted for these trainings. So we looked at prior trainings that our providers had, and we gave them credit if they had already covered the content in the last 2 years that was backed up by our Caring for the Children content list. Same with the college coursework content. We gave them credit if they had already taken the coursework in the last 2 years. This also allowed them to see if they were missing a specific area, they could go on and take just that specific content in a webinar format. So like if they were missing training around transporting children, they could just take that training. Next slide, please. So as we develop the modules and our in-person training to really look at how are we ensuring the effectiveness of this training, throughout the modules there's embedded checkpoints to ensure that the material is being understood, and at the end of the module there is assessment, and in order to get credit you have to have passed the assessment with a certain percentage, and then once that happens you can have a certificate. We also have coaches that are working with programs to develop program improvement plans. So looking at this, we wanted to ensure that they were understanding the content, and if they weren't, then our coaches could help steer them to other trainings. Next slide, please. So we began also in 2015, we spoke to our higher ed community, and we worked with our community colleges and our four-year institutions to make sure that as they looked at their coursework that they embedded these into the existing early childhood courses. For that way, for those people who had those courses, they would have already met this requirement, and then also it makes it much easier for those providers to be hired. If they've already met this requirement, they wouldn't have to do that. They wouldn't have to wait to take this. But there are those who enter the field without college coursework, and so for those we made the determination that we would allow them the 90-day orientation period so that they could take that at a later, within the first 90 days of hire. So next slide, please. So for ongoing training around this, as we move this forward, the providers in our state are currently required to take between 12 and 20 hours of training of continuing education per year. It's based on where they're at in the system, whether they're licensed on our Paths to Quality, our QRIS system. So around that, we have training topics that are available with more in-depth information in a webinar format, and some of them are available in face-to-face formats as well. So we currently are allowing them to choose the topics that they want to dive a little deeper into, but we also have them working with coaches to develop program improvement plans. So as coaches go into, or even licensing representatives as they go into programs, if they see there's an issue around safe sleep, then they definitely require them to go ahead and take an additional training around safe sleep. Or if they see, if a coach goes in and sees that there's issues around administering medication or children with allergic reactions, then they can refer them to those types of trainings. Next slide, please. So we've worked with a technology vendor in our state to enhance our current software, and it tracks the compliance of all child care staff statewide. And it allows us, as our licensing consultants go out, to monitor this requirement. I believe that is my last slide. Were there questions?
Let's see. Yeah, let's hold the questions until after we've heard from Oregon, and then we'll open it up to a little Q&A. But thank you so much. That was very helpful. That's a lot of information. So thank you for sharing your work. bear with me while I pull up the next set of slides. So next up, we have Kelly Walker, who is the Child Care Policy Manager for Oregon. I'm assuming it's Oregon's Department of Early Learning Division, your Early Learning Division. Is that correct, Kelly?
That's correct. Early Learning Division at the Department of Education.
Perfect. Thank you very much for joining us today. And I will hand it over.
Okay. Thanks, everybody. I'm so happy to see so many people on the phone and lots of names that I'm familiar with. So I am the Child Care Policy Manager for Oregon's Early Learning Division, and lately I've been self-describing myself as the implementation queen. And I am happy to offer just a snapshot of a piece of the work that Oregon implemented to meet the new CCDF requirements. And I know for us it's been a real crazy time, and I know states and territories are working really hard to meet these implementation deadlines with rule development and communications plans for every major change. So September 30th was a big date for us here in Oregon. So I've been asked to talk about our introduction to child care health and safety training and where it fits in with our overall professional development continuum. So a little on the background. Oregon has a considerable number of exempt child care, mostly home-based. And a number of years ago, we were looking at our license-exempt child care, and they self-certified their compliance with CCDF rules on health and safety. So we at that time developed an online training for the license-exempt providers so that they'd have a basic understanding of child care health and safety, primarily in a home environment. So during the first year of that training, thousands of individuals completed the online training. It was really our first experiment with statewide online training, especially for the licensed exempt and relative population. So during the first CCDF notice of proposed rules before the new law, we started to evaluate the workforce and looked at how early care and education providers and whether they had a basic foundation of knowledge in health and safety and what we would need to do. So with the passage of the Block Grant Act of 2014, we took our original online training and made it a requirement for all providers, substitutes, and directors in both licensed care and license-exempt care, along with, for us, what's called a safety set, which is your first aid, CPR, recognizing and reporting child abuse and neglect. We took that training and revised it to include what I call the 10 subject areas, because I don't count the safety set, but we really looked at this training as a foundational training that would cover all the areas in federal rule and provide a platform to build upon. So it does provide a basic understanding of all the required area in the federal law and the new rules. Do you want to go ahead and go to the next slide? So the course title is Introduction to Child Care Health and Safety. And with all the new work we've been charged with implementing, for us developing sound policy and making decisions about how the policies would affect all providers and children furthest from opportunity was really an important value to us. So we have a child care policy team, an interagency group that meets to make some recommendations to guide this work. So we decided that, yes, the course needed to be offered online, and it was incredibly important to us that it be available for all of our primary language groups. So we have the online course available in English, Spanish, Russian, Vietnamese, and Chinese. We had a couple of snafus with the Vietnamese and Chinese language, so those were not able to launch at the same time as the English, Spanish, and Russian, but should be available, I think, by next week for our Vietnamese and Chinese speaking folks. So it's, again, I said it's required of all providers and substitutes who are allowed by rule to have unsupervised access to children and directors. We do have a in-person training that we've also do, and actually the Oregon Kids Healthy and Safe is a course that was created by our formerly Oregon Health Department, now it's the Oregon Health Authority, and we took that course and actually adapted it to online, and now we're going in reverse. So we're taking all of the additional components that we created to meet federal law, and are adding that to our in-person training and doing some webinar Train the Trainer in December, so that all of our trainers who are prepared to teach this in-person course will be able to do so very soon. So I told you earlier that the training is pretty good foundational information. And what we are doing, actually, if you, before we go to the next slide, I want to say that we are requiring that everyone who is in the early care and education field, who are working in centers or in license-exempt homes or child care centers or in any licensed type of care, must take this course by June of 2017. Going back and figuring out what college courses covered it, what place they were on our state registry, just proved to be really complicated. And since it's short and really good basic information, we are requiring it of everyone. And what I've heard from the field is that people think it's a great refresher. And for folks who don't have much experience or exposure to the industry, it's a really good foundational training. So in Oregon, we have our Oregon Registry Online, and it's the system that tracks all of our professional development. And so if you take this course online, it's offered through our Oregon Center for Career Development, and so it automatically enters into our registry system. And for licensing specialists who will be monitoring all types of care, including the license-exempt care, it will show up on the staff qualifications and training log. So right next to their CPR, first aid, recognizing and reporting child abuse, it will show that the staff person has taken the introduction to child care health and safety. So if you can go to the next slide. So I mentioned that the training is foundational, and with our new category in Oregon of regulated subsidy, we didn't monitor those providers before. We know that many of those providers and many family child care providers are new to child care. So the next step for that particular group of folks is a technical assistance session that the licensing specialist will conduct during the visits that they're going to be conducting for the on-site inspections. So we've taken every area under federal law and adopted technical assistance resources that our licensing specialists will do one-to-one work with the providers to help build their knowledge that they acquired in the initial training. And what I didn't say, because my colleague from Indiana already said this, but our online training is really interactive, and there's also an assessment in the end to make sure that you've understood the information. So the resource topics that will be available, you don't need to go quite yet to the next slide. The resource topics are in all the areas required under federal law. We didn't create anything new necessarily. We adopted documents by the American Pediatrics Association. There are some excerpts from things from NAUIC. We've added additional information on nutrition, physical activity, and developmental screening, because it's been really important to us to make sure that developmental screening information gets out there. And then after they've done this foundational training or other folks in the field, there are required training hours with a certain number of hours in child development or early childhood education to further increase the provider's knowledge. So all of our types of regulated care, including the license exempt, have a certain number of training hours that they're required to complete either annually or biannually or every other year, every 2 years, to increase their knowledge. Now you can go to the next slide. So the last two things I just wanted to mention, in addition to our introduction to child care health and safety that everyone's required to take, we have a couple of other new online trainings that we were really excited about. And one of them we've been working on for a long time, and that's the Oregon Early Learning Standards. So Oregon adopted the Head Start framework a number of years ago, and now, of course, it's slightly different, but we have a training that's available online for folks on Oregon's early learning standards. And then the other section that we did, at the Oregon Department of Education, we have a statewide homeless liaison who works with individuals from all over the state. So every school district is required to have a homeless liaison. And so we've developed a self-study training for providers on serving families experiencing homelessness. And as you can imagine, it brings in a lot of the principles of trauma-informed care, and then helping, understanding resources available, and then has a couple of informational videos about working with the homeless liaisons in the state as well. So we're really excited about these two trainings as well. So I think I will stop there, and we can have questions, or if anybody wants to know anything else about what we've been doing, I'd be happy to help with that on an individual basis as well.
Okay, thank you very much, Kelly. I really appreciate you sharing your experiences and like what Oregon's doing. I guess, and I also appreciate you introducing the term automagically into my lexicon. I'm going to try using that to help my 4-year-old get to bed faster.
Good luck with that.
Thank you. So I guess we're going to open up to questions and answers, but a general question that we had for both of you, but I'll throw it out to you, Kelly, first, is as states are working on developing their health and safety trainings and coming into compliance, as the implementation queen, what advice would you give to other states who are starting down this path?
I think that my colleague said it well, and that, communication plans for me have been absolutely key. That for every single, the FBI fingerprint background checks, the new training requirements, the rule amendments that we've had to make for all different types of care, I have a communication plan for every single one of them, so that there's a simultaneous information that goes out to all of our child care resource and referral, our entire licensing staff system, all the child care providers, the child care provider unions, on the website. And so it's really well communicated, and then communicated again, and then communicated again, because we just can't get enough information out there. And people are overloaded because we have made so many changes. And when they get another formal letter from the Office of Child Care, I'm sure people are rolling their eyes. So trying to find alternative ways to communicate with people has become really important.
Okay, thank you. That's very helpful. And Rhonda, do you have any thoughts on advice that you would give to other states?
Yes, I do think that it's important to help providers understand the why behind why these rule changes are happening, and I think it makes it a little bit more palatable for them if they understand why, what is this change going to make better for them and for the lives of the children and families that they serve. I know there are a lot of changes coming, but I do think that helps them understand them a little bit more.
That's great, thank you. And then while I have you in your presentation, you talk about the documentation and tracking process. And I know that that's an area where states have a lot of questions. So do you have any insights as to what states should keep in mind when they're working with their technology vendors or developing that kind of tracking system?
We really, we don't have a registry yet in Illinois. We're just at the very beginning phases of this, and we actually use this to begin the development of a registry. So I think it's important to ensure that you work with all the systems that are already in your state and make sure everything links together. Make sure that that whoever is going to monitor to ensure that this is that providers are compliant, make sure they have access to that online. And making sure that as you develop it, all of the trainings that are required are there, whether they're required right now or will be in the near future. Of course, with technology, it's always easier as you develop to go ahead and put it in now as opposed to go back in and try and have to redo it.
Great. I have another question for Kelly. You mentioned in your presentation that you made trainings available in the five primary languages that you serve. Did you have what were some of the challenges that you faced as far as like getting the translation and getting those up and running? I know that some states are really interested in going down that route.
Well, we have a really focused, purposeful translation policy and way in Oregon with the way that we go about working with translations, and quality is really important to us. So we, I've developed a, what do you call it? The glossary, I can't remember what it's called. Anyway, the language, so that we have words in all the different languages that really reflect what it is we're talking about. And we also have staff who speak all of the languages that we are translating. So we do send it out for a paid translator, but then we have a staff review of all information to make sure that it's meeting our quality standards. I still can't remember the name of that. The dictionary. That's what it is. The language dictionary for early care and education. Does that answer your question?
Yeah, no, I think that's definitely helpful to kind of just get a sense of the framework that you're working with when you're doing that, and some of the background.
Yeah, and the other piece I'll tell you is that we're going down a path where probably at some point soon we'll be looking at the Somali language as well.
That's great. A question that we have for both of you, but I'll throw out to Rhonda first, is did you have to do anything different when reaching out to licensed exempt providers? And did you have any advice for states who are trying to reach out to that population for the first time?
We reach out to our licensed exempt providers through our CCR&Rs. And also some of our licensed exempt providers get coaching from our coaching cadre. So we have multiple ways that we reach out to them. We have contact information, so again, they would have received all of the letters and the emails as well.
That's great. Kelly, did you have any thoughts on this?
I would say we've done those things too, but we also have a child care provider union. So we've really engaged our union leadership. And before we started any of this, when we were just looking at figuring out how we were going to do this training, we did a lot of engagement. So community engagement is another really important value to us, and we try and engage all stakeholders. So we talked to a lot of licensed exempt providers.
Okay, great. A quick reminder to those listening that you can type in your questions into the chat box, and we'll try to get to them as we're going through this Q&A. So thank you, Rhonda and Kelly. Just a few more questions that are coming in. Can you speak a bit about incorporating health and safety trainings for the school age population? That's a question that some people are asking. I guess I'll throw it out to Kelly first.
I think that Rhonda is going to have a better response to that since they addressed it. So, Rhonda, I'm going to let you respond.
Okay, well, we really looked at the health and safety requirements and decided that health and safety is health and safety, whether you're, of course, it's a little different for infants, but once you start getting up into toddlers, preschool, school agers, health and safety is very similar. So we developed the modules that we developed in the training, we feel like is inclusive of health and safety for all ages. Now, we did also look at child development a little bit differently and developed a course specifically for providers that were caring for those school-age children, and went from birth all the way up through that age 12 on that training. But really think about it, an environment needs to be safe no matter what age child you're caring for. Medication is pretty similar. So it seems pretty encompassing.
And this is Kelly, what she said.
Great. Thank you for that. Another question that came in is, do you have any mechanism or way of measuring whether or not the impact of the training, like whether or not it's actually changing caregiver or teacher practice after the training is completed?
Okay, this is Kelly. I'll start with that one. And you know, I think that that's a real tough question, and I saw that as a suggestion to address, and I purposefully ignored it. I think that with this particular training being foundational, that where we're going to see teacher change and behavior change is in the follow-up technical assistance and follow-up training, as we're reaffirming the principles and basic information that we offered in the training. That's what I'd have to say.
Okay, thank you. Oh yeah, sorry.
Yeah, sorry. This is Rhonda, and so one of the things that we've started to do is to track the licensing violations and see what's the top 5 licensing violations, because that seems to be right in line with the health and safety training that we are providing. So we're tracking to see, is this making a difference? What areas are we seeing go down, or what areas do we see now that we need to hit with more training?
That's great. Thank you for that. That does make a lot of sense. A question that's coming in is, someone from another state is asking if any of the trainings that you've developed are accessible to people from outside the state, or is it purely internal?
So Kelly, I'll start. This is Rhonda from Indiana. Our training is actually accessible to anyone. It was created with CCDF dollars. You can access it on trainingcentral.org, I believe is what it's called. Sorry, I'm actually off-site. I'm doing this presentation, and so you're really taxing my memory here about a website address. But if anyone wants to reach out to me with an email, you're welcome to do that by email, and I can shoot you a link to get to it. But we also, since this was a requirement and we developed it with CCDF dollars and in partnership with an Indiana partner here helped fund this training, we wanted to make sure that it was free so that providers, it wasn't taxing on them to meet the requirement. But we have opened it up and anyone can get on our site and take those trainings.
And this is Kelly, and our training is also online, and there is no fee to take it. I am not sure about how the certificate works for someone outside the state. Like I said, for ours, once you've completed it, it automatically fills into your registry account. So that I don't know off the top of my head. The other trainings are available. The ones I talked about are available. Oh, the other thing I was thinking of is that our training is based in Oregon rules. So as we went through and developed the training, we were looking at CCDF, CCDBG, Oregon rule. So there may be some things in there that, may not be true in another state.
Yeah,
I'm glad you brought that up. Yeah, because that would be indicative of Indiana too, and we actually throw in a story about, which is a good story, but in our training we used a story from a local provider, an Indiana provider who saved a baby's life by using safe sleep techniques. It's a pretty powerful video.
Yeah, and as I say, making it available is very helpful, even if it's not directly applicable to another state. Being able to see what you have developed as other states are moving forward, I'm sure will be a useful resource to people. So thank you for that. Another question that just came in is, someone is wondering if once you started to reach out to licensed exempt providers, if you saw, did that have any impact on the number of licensed exempt providers that were willing to participate? Did that have an impact, or did you see any change there?
So
So this is Kelly. We don't have statistics on that yet. We anticipate it will, because our requirements for license-exempt providers have kind of increased gradually over the last few years. And so even with our first training requirement, we noticed a decrease in license-exempt and many more individuals choosing licensed care. So we do anticipate that it will definitely make a difference.
I'm going to go with what she said.
We're good, Rhonda.
Yes.
Okay, thank you for that. A question I had, and this is to Kelly again, because you mentioned that the work that you're doing with homeless families, or families experiencing homelessness. I know that's an area that you have developed a lot of groundwork, and a lot of states are looking to ramp up there due to the regulation, the law. When you reached out do you have any advice for people who are looking to reach out to their state coordinator or their homeless liaison if they haven't done so yet?
I don't know if I have advice, but I tell you, find the person, because ours has been doing this work for a long time. She's so enthusiastic. If you watch the video that's part of this training, I mean, she is amazing and has so much passion. And the folks that she's working with around the state are really, really dedicated to, helping folks and really understanding the challenges. So, we've met several times. We met during the development of the state plan, and then making this training. So we're really hopeful for some great partnership in the future.
That's great too, because when we do trainings on a federal level, I always tell people to reach out to those liaisons, and so it's great to hear that you've had that experience, because I know that, like you said, they've been doing this for a long time, so they have a lot of those resources, they know a lot of the connections. So for those states who are don't have as much experience working in that area, that is a fantastic resource to start with, and
they're also really happy that we're working with early learning environments and early families who have young children.
And that's great. I was at a training once, and sorry. Was that you, Rhonda?
Yeah, it is. Sorry, I was just going to add to that. I thought we were only talking about health and safety. We also have a homeless training that lives on Training Central as well, that we worked in conjunction with the Head Start Collaboration Office to put out for our providers. So we really looked at Head Start, some of their new rules and some of the work that they've already done as we developed that. So I totally agree with what's been said, but another good aspect to tap into is look at eClick and look at some of the Head Start things that have already been developed. There's some great things already out there.
Thank you for taking the time to plug a federal resource. I'm sure our oh yeah. The Head Start eClick does have a lot of great resources there. Someone
and we
had a question.
accessed all of those in the development of our training too. So I completely agree.
Okay, great. And I could ask you this question, Rhonda, since you're out of the office, and I don't want you to make up website addresses on your on the fly. But someone wants to know, as far as the Oregon training, do you have a link to a website for that where people can access it?
Yes, I can. The links were on the slide, but I'd be more than happy to send the links to the training to you, to everyone.
Is it this one?
Oregon.
Yeah, if you go to the first one, you can also find the online health and safety.
Okay. Okay, we'll send out information. And another question that always comes up is whether or not we'll make these PowerPoint slides available. So the federal slides we're going to send out definitely once we make them compliant, and then we'll talk about the Oregon and Indiana slides and see about sharing that information as well.
Yeah, coaches question. There's a question. So someone wrote in a question about, do states provide coaches, and is a cost attached to it? So I know that you all spoke to having follow-up TA. I think it was Oregon that talked about that. But could the person who was talking about, well, afterwards we have some follow-up and a TA experience to help with this, speak to that some more? I think it was Kelly.
I think we both, this is Kelly, we both kind of talked about that. What I talked about is the technical assistance that's provided by our licensing specialists, particularly with the new regulated subsidy and family child care. We have some very specific TA documents and information. And I think Rhonda was talking about coaches, which we have to in a slightly different capacity.
Okay. Rhonda?
Yeah, we have coaches that work with our programs, and they're working with programs to develop program improvement plans. And very similar to what Kelly just said, also our licensing consultants will go in and of course, if they see areas where programs need additional help, they refer them. Sometimes they actually require them to take additional training around some of these health and safety topics. And so no, there is not a cost to that also. The coaches come right now they're a part of our Paths to Quality system. So if you join the system currently, you are provided a coach to work with you.
So that's great. There's not a cost attached for the individual. The individual doesn't pay a cost. Right.
Yes,
okay. That's great, because I mean, given the question we had before around how do you know that this has changed practice? Obviously, that's one of the ways, by having folks be able to go out in the field and really work with people and do program improvement plans, et cetera, if they need them. So that's one way that your state's handling it. Sounds like a good example. The states are interested. Thank you.
Okay. Well, I know that we're about to run out of time, so thank you so much for joining us today and answering our questions, even though the ones that you didn't really want to answer. We know that from the federal perspective, getting the regs out was a big lift, but we know that from this point on, this is where a lot of the work needs to be done at the state level. So we really appreciate you coming in and sharing your experiences and some of the challenges you face and your successes. I think it's really helpful for us to hear, and I think it's really helpful for other states to hear as well. So thank you again for joining us. Do you have any last words you want to share, Rachel?
Oh, I just want to thank you also, and again, say to all of those folks listening how much we're plugging for you and how much we want you to be successful and want to help you, and want to make sure that this session in particular was useful for you. So if you do have thoughts on what worked for you or what could be different, please do let us know. And is there going to be a vehicle for that afterwards, or should they just put it in the chat?
I would say get in touch with your regional offices.
Okay.
Probably, or if you are, reply to if the information that you got out about the webinar, you can reply to the OCC announcements email address as well. Those are probably your best options.
Great, thank you. And thank you everybody on the phone. We hope that this was useful to you. We wish you a lovely rest of your day and have a great holiday next week if you're celebrating. And we look forward to our next session, which will be in 1 month on the 3rd Thursday. I think it's December 15th. And that one will focus on subsidy and graduated phase out. So we hope these are useful. Have a wonderful day, and we will see you in a month.